Thank you for coming. We're happy to honor Senator Schumer's efforts to improve student health. Our board of directors are school nursing leaders who provide each state's unique perspective on challenges and innovation. It's so important to have that perspective from across the country, and NASN is very lucky to have a board of directors representing all areas of school nursing from across the country. We are very pleased to unveil our new ratio ruler. The 2009 Student School Nurse Ratio Ruler. The data on the number of public school full-time equivalent nurses has been collected by each NASN director and carefully vetted by state school nurse consultants and other state school nursing leaders. Although budget cuts have affected the capability to collect accurate data, NASN works very hard to improve the quality of the data provided. So we feel that we have the most accurate information possible, showing the number of nurses per students in our country. NASN collects this data specifically to highlight the importance of having a nurse in every school building. If you look at the ruler, you can see that while some states have shown inspiring gains, NASN is concerned for the erosion of ratios in some states and within certain areas of some states. We know with the economy this has been a problem in some areas. There's been significant progress in states such as Georgia, Illinois, Mississippi, and Kentucky. We're happy to report that Utah has moved from its bottom position on the ratio ruler due to school nurse advocacy in that state. The Northeast states remain strong with ratios under 1 to 600. However, there's been erosion in Michigan, which has the new bottom position, and the states of Montana, North Dakota, and Maryland. So why does this data matter? What is the importance of a school nurse? Children today face more complex and life-threatening health problems requiring care in schools. A growing number of students have multiple disabilities and require ventilators, central lines, and IVs. Many others require daily interventions by the school nurse in order to come to school. Over 66,000 school nurses across the country promote health and safety, intervene with actual and potential health problems, provide case management services, and actively collaborate with others to build student-family capacity for adaptation, self-management, self-advocacy, and learning. Only registered school nurses can safely be in charge of quality professional health care for students in the school environment. They have the education, the knowledge, and skills to assess needs, develop and implement plans, and evaluate outcomes for students. School nurses are on the front line of defense and provide a critical safety net for our nation's most fragile children, enabling students with chronic health conditions to attend school. Improved attendance, we know, equals academic success. School nursing is an investment in our children's future. NASN recommends a needs-based formula approach for determining appropriate full-time school nurse to student ratios. The numbers alone don't do it. We need to look at the complexity of the conditions of the students we're caring for. The H1N1 epidemic raised public awareness of one of the critical roles of school nurses, protecting children in the community from infectious diseases. The school nurse's role includes assessing the student health status and making referrals, collaborating with other healthcare providers, working with school staff to share critical information on school health plans, identifying vision and hearing problems that impact learning, delivering emergency care, administering medication and vaccines, performing health care procedures, providing leadership in disaster preparedness, and addressing the mental health and substance abuse issues of students, just to name some of the things school nurses do every day. Additionally, having a school nurse to address health concerns keeps students at school and parents at work. and allows teachers to teach instead of trying to provide health care for children. The school nurse also works within the school community to provide professional input and assistance to combat childhood obesity, poor nutrition, asthma, and other chronic conditions. So in closing, school nurses are committed to keep kids healthy in school and ready to learn. Every child deserves a school nurse. Thank you for coming.